Hello and welcome everyone. I'm Jason Steffen, MLA for Red Deer South, and I'd like to welcome you here to this conference this beautiful afternoon. I'm joined by my colleagues, Associate Minister for Mental Health and Addictions, Mike Ellis, and Minister of Education, Adriana LaGrange, who is also the MLA for Red Deer North. I also have the honor of introducing City of Red Deer Mayor Ken Johnson, Mike McCauley, Superintendent with Red Deer RCMP, and Dr. Nathaniel Day, Medical Director of the Virtual Opioid Dependency Program with Alberta Health Services. We have a full agenda today, and so without further ado, I'd like to turn the mic over to Minister Ellis.
Thank you very much, Jason, and thank you everyone for joining us here today. So I'm so pleased to be here in the city of Red Deer, where we're working together with the Red Deer RCMP, with the city of Red Deer, our local MLAs, and Dr. Day's amazing team to help us help get more people into recovery from addiction. The relentless and progressive illness of addiction is affecting Albertans, their families, and our communities throughout Alberta. We see the destruction of addiction in our streets, in our neighborhoods, and everywhere in between. But if we look closely, we also find that thousands of Albertans who live their lives in recovery every day, who show us that recovery is indeed possible. They are those who tell us that we should not give up on anyone and that everyone should be supported in their pursuit of recovery. This is why we're building a recovery-oriented system of care so that people can move past addiction and into recovery. Not everyone starts their pursuit of recovery in the same place. For some, it begins at home. For others, it begins in detox. And for some, it begins when interacting with the police. So no matter where someone starts their pursuit of recovery, they deserve our full support. We started by increasing access to addiction treatment. We now fund over 8,000 new treatment spaces every year and have eliminated user fees for all public spaces. This means that over 8,000 people can access detox, treatment, recovery services across Alberta every year free of charge. We've created the digital overdose response system to reach nearly 70% of people who lose their lives to addiction at home. The system provides emergency response to those using at home alone if they become unresponsive while using drugs. The life-saving system was recently expanded to Red Deer and can be downloaded by visiting doorsapp.ca. We're building 5 new therapeutic communities, the first of which will be opening right here in Red Deer in the not-too-distant future. They'll provide long-term addiction treatment free of charge to those who need it. One of the things I'm most proud of is that we are able to offer treatment on demand for opioid addiction in partnership with our friends at the Virtual Opioid Dependency Program. Any Albertan, anywhere in the province, can access treatment the same day with no wait lists and no fees. All they need to do is call the toll-free number beside me or by visiting vodp.ca. That means same-day access to life-saving opioid addiction treatment medications like Suboxone and Methadone and the new long-acting Sublocade. Once we eliminated the waitlist for VODP, we started looking at how we can help more people access addiction treatment. That's when we began bringing police and health services together to ensure that any Albertan who is arrested for any reason can access life-saving addiction treatment. We started in Edmonton and Calgary and some rural RCMP locations, and I'm very proud to say that as of the end of June, we will have seen very much tremendous success. To date, over 400 people have consulted with the Virtual Opioid Dependency Program while in police custody, and the majority of these folks leave custody having started treatment and having connection with recovery supports. This is a first of its kind initiative in Canada. Alberta is leading the country, and it is already saving lives. And that's why I'm announcing today that this innovative partnership between the Virtual Opioid Dependency Program and the RCMP is coming right here to Red Deer. Moving forward, anyone arrested here in Red Deer for any reason will be presented with the opportunity to access life-saving addiction treatment. As a former police officer myself, I've seen far too many people who are arrested who have the illness of addiction and who want to help out, but we as police just didn't have the tools to help them. And now there is hope. This will give more people an opportunity to access life-saving treatment, pursue recovery from addiction, get their lives back, and re-engage with family and stop the cycle of abuse. The reality is that people who commit a crime must still be held accountable for their actions, but we can treat addiction as a healthcare issue while keeping our communities safe. This is consistent with our approach to addiction, an approach that is fair, it's firm, it's compassionate, it is fair to the communities and families dealing with the illness of addiction. It is firm with the illness of addiction itself, and of course it is compassionate to those who are struggling with the illness of addiction. This is the right approach to ensure that we are building healthy communities across Alberta right here in Red Deer. Before I conclude, I'd like to acknowledge that none of this would be possible without the support of our partners, including the Red Deer RCMP, the City of Red Deer, first responders, community organizations, and more. So thank you. Thank you to everyone who works on the front lines, who are behind the scenes to help Albertans with the addiction and their pursuit of recovery. And thank you as well to the thousands of Albertans who have taken the courageous step to pursue recovery and tell their success story. And with that, I'll now invite Mike McCauley, a superintendent with the Alberta RCMP, to speak. Thank you.
Thank you, Minister. Welcome, Minister. Mr. Stefan, His Worship Ken Johnson, and Dr. Day. On behalf of the Alberta RCMP, I'm proud to stand alongside our City of Red Deer partners and Alberta Health partners for this great program to be announced. We firmly believe that in order to keep Albertans safe and to reduce harm in our communities, we need to continue identifying and addressing the root causes of social harm. This program does just that. As first responders, police officers have an important role to play in the addiction crisis. Our frontline members see the effects of opioids and dependency and addiction firsthand on a daily basis. Some solutions need enforcement, but many of them need the health approach that we're taking here today. I would equate it to the analogy of a stream. At the bottom of a stream, traditionally police would be fishing people out of the river in order to provide enforcement to deal with people at their worst. Now we're trying to walk upstream. We're trying to look and find and identify the problems of what's causing them to hit rock bottom. And this program, the Virtual Opioid Dependency Program, is a perfect example of that. We were able to partner with our city folks as well as our addictions partners and Alberta Health to provide service to Albertans in a health manner in order to then reduce social harm. We are proud to partner with our friends on this initiative. So far in the province of Alberta, we're in approximately 30 different communities, and the City of Red Deer is going to be an amazing example of this as well. So thank you to Alberta Health, thank you to the City of Red Deer, and the RCMP is very thankful for this program so that we can help all Albertans.
Alberta's Virtual Opioid Dependency Program is pleased to work with Red Deer's Police Service. I am truly thankful for the support of Alberta's government and for the collaboration we have had working with police services, including the RCMP. It is important that we reach people in need wherever they are. The medical evidence shows that opioid dependency treatment, which we are now able to offer to detainees right here, reduces a person's all-cause mortality, or in other words, decreases their likelihood of death from any cause, including overdose and suicide, by more than 50%. Offering the Virtual Opioid Dependency Program to anyone in municipal jails who is experiencing withdrawal is compassionate. Relief from suffering is almost immediate. This initiative will help those who are ready to start life-changing and life-saving treatment right at the very moment they need it. People who want treatment should find life-changing recovery options wherever they turn. This program has a proven track record for helping address addiction and helps people live the full, healthy lives that they and their families want. For those people who are using any street-obtained drugs, opioids or not, I encourage you to download and use the Digital Overdose Response System app. It's available in your app store for free. If you are using the app and you go unconscious while using, the app can connect you with paramedics who can be dispatched to your location. Using this app could literally save your life. Alberta is a leading jurisdiction at improving access to assessment and treatment. You do not need to be arrested to access this service. Alberta's virtual opioid dependency program is open 7 days a week and does not have a wait list. If you or your loved one are looking for safe and effective evidence-based treatment, call our toll-free number today, 1-844-383-7688. We're open right now. Our professional staff will take your call. They'll answer your questions and they'll explain your options, including the once-a-month injectable treatment Sublocade. You will have the opportunity to move forward with treatment, most commonly starting right away. It doesn't matter where you live or work. In Alberta, we want treatment available everywhere. Thank you.
Thank you and welcome, everyone. As the MLA for Red Deer North, I'm very proud to be here today on behalf of our community. Too many Albertans are losing their lives to the illness of addiction. The illness of addiction is a crisis that we see every day here in Red Deer, whether it's in our streets, on our streets, or in our homes. Unfortunately, we see much too much of it. I know there is so much more we can do as a community to help people recover from addiction, to get their lives and their families back, and to be part of a healthy community. That's why I'm so encouraged with today's announcement. Looking around, I see people from different organizations and levels of government who are all dedicated to helping Albertans build a better life. Every Albertan struggling with opioid addiction deserves the chance to pursue recovery. There are mothers and fathers and sisters and brothers. They're people we know. Making treatment immediately accessible when someone is taken into police custody is giving them an opportunity to choose recovery. I'm pleased to support a program that will make a positive difference in our community and will work so well within the integrated wraparound model that is being pioneered in central Alberta, and I dare say in Alberta in general. That provides help to people who really need it and gives them the hope that recovery is possible, because it is possible. Thank you, and now I'm pleased to welcome His Worship Ken Johnston to say a few words.
Well, good afternoon, ladies and gentlemen. I don't know if you are like me, but it is difficult to not be emotional on a day like today. It is difficult to stand here and appreciate without emotion, without heartfelt emotion, what this day brings to our city, what this hope brings to our city. You know, when the Premier was here a few months ago and made the hospital announcement, I was very pleased to say he was bringing hope for tomorrow. And he was, and still is. But today, with our provincial partners and with Alberta Health Services and professionals like Dr. Day, we're bringing hope to Red Deer this very day. And this is why I think it's an opportunity for us to celebrate, and to celebrate with emotion and celebrate with gladness. So on behalf of my Red Deer City Council colleagues, and I'm joined today by Councillor Hyam and Councillor Daw, and also by our City Manager, Tara Lodwick. My goodness, the Mayor couldn't be better supported this afternoon, my Chief of Staff as well. It is so encouraging to see you. Sadly, my friends, Red Deer is no stranger to the effects of the global opioid crisis. Providing options for people who are suffering with addiction is key to solving the crisis, and meeting people where they are with what they need is vital. We are thrilled to see this collaborative approach available in our city, and I want to personally thank Minister Ellis, who I met when he took over the portfolio and I was elected. We broke some ground together in November, and I said, Minister, when are we going to be able to bring the VOPD into the RCMP partnership and so on? And he said, Mayor, you've only been elected a couple of weeks. Give us a little bit of time. And my goodness, isn't it wonderful? The program and the technology are a tangible way to help transition people who want help onto the recovery path and onto a better future. And we're so pleased that the government has extended this innovative and groundbreaking program to us. Hearing the successes, ladies and gentlemen, that Edmonton and Calgary have seen since launching this program gives us hope that we too, and we will, reduce overdose deaths from opioid usage and enhance the support and help for people who need it most. Making services available and easy to use will open the door to those who may be struggling to find a way to help when and where they need it. I would like to thank once again the provincial government, our RCMP colleagues, and I want to say, Superintendent, how encouraged I was when you said the words, "This will make an amazing difference." This will make an amazing difference because the folks who serve us in the uniforms of the RCMP see us at often our worst. And so when this comes to make an amazing difference, it just brings my soul and spirit way up today. So thank you for coming together to form such an effective tool and partnership in helping Albertans, and if I might be subjective, Red Deerians today. Thank you very much.
Thank you for everyone who spoke, and I appreciate your words, Mayor Johnson. I think about emotion too. I feel excitement. I feel great excitement for today's announcement. We are meeting people where they're at. And the great thing about the virtual opioid program, individuals who are in incarceration have made perhaps some bad choices. We're giving them the opportunity to make a positive change that will not only be transformational for themselves, but also as a parent, for their families and for the community at large. This is a great announcement and a great day for our community, and I want to thank everyone who's come to hear about this. I look forward to seeing transformation for blessing individuals going forward from this wonderful announcement. And with that, we'll turn the time over for any questions from our media partners.
Thanks so much, everyone. So first and foremost, thank you everyone on the line for bearing through some technical difficulties. Unfortunately, because of that, we're going to have to wrap up relatively quickly here. So we've got a question in the room, and then if there's any questions on the line, please just follow up with me. My information's on the release there for you. So we'll go to our question in the room here, and that'd be great.
Hi, my name is Ellis, and I'm from RD News Now. I have actually two little clarification questions and then one question for the superintendent. So my first would be really towards the clarification of the VODP. Are the physicians located here in Red Deer, or are they all centralized, perhaps in Edmonton?
Yeah, appreciate the question. I think that Central Albertans can be really proud of the fact that VODP actually was built here in Central Alberta. So the very first beginnings of VODP as the Rural Opioid Dependency Program was just minutes north of here in Ponoka. And so most of our physicians are based out of Ponoka, actually.
Oh, fantastic. And how many are there exactly?
Well, it depends how you count them. I think the safest way for us is to say that we've got 9 physicians who are working with us right now.
Fantastic. And last question for you, actually. I'm so sorry about that. I miscounted. Would there be a complication, let's say, with those also experiencing homelessness at the same time? How could they move forward with this process?
Yeah, I really appreciate that question because it highlights a really important issue that some of the people who are most affected by addiction also are affected in other social ways, like experiencing homelessness. As part of the original project for bringing in VODP to work with police services, including with the RCMP, was also an effort to work on what we call our low barrier urgent access team, which actually is working to connect with people who are experiencing homelessness wherever they are in our province. So for example, it doesn't really make any sense to do things the traditional way, where we say to somebody who maybe doesn't have a home or a watch that we're gonna have an appointment with you next week on Thursday at 3. Rather, what we do is we work with whatever partners they're working with, we work with the pharmacies near where they're staying, and when they connect, we just meet them right then and there and give them the services that they need right in that moment instead of booking an appointment that they're gonna miss. So our team is doing a ton of work to actually just meet people exactly where they're at and figure out ways how our health system can change to meet those needs. Instead of demanding of these people who are vulnerable and are experiencing significant challenges, demanding of them to jump through our hoops to meet us, we need to get to them and meet them where they're at.
Fantastic, thank you. And my question for the superintendent would be, how needed is this in Red Deer specifically, and why?
Absolutely, Red Deer is needed because, as His Worship said, unfortunately there are several hundreds, if not thousands, of folks that are suffering from opioid addiction across the province, but Red Deer is no different. A program like this 100% will provide a benefit. Our frontline members, they know they have to do enforcement, but we are driven to help people. And this is a program that is not just putting handcuffs on someone, it's taking someone who's at their worst and giving them a solution. And the care doesn't stop there. In our other detachments that this has been up and running, our members are approaching people on the street and offering them this program. So it doesn't have to come with an arrest, and that is a great option that we have to help someone at their lowest. But by all means, we help folks on the street. We, in other jurisdictions, and it'll happen here as well, is we're partnering with other addiction services within the city, and again, cross-referring to take a holistic approach. So absolutely it's needed, and it'll be, I have no doubt it'll be effective, and we'll continue to expand on all these services and these types of programs to, again, as I said, at the upstream and midstream, to not wait till they hit rock bottom. We're gonna try and intercede and help them before they get there.
Beautiful, thank you.
I just wanted to take a moment and, as I stepped away from the podium, realized that I didn't mention one of the other big tools that we have for people who are vulnerable and for all Albertans. And that is something that I'm just tremendously proud of here in Alberta, and that my colleagues across the country are envious that we have here, is that the government of Alberta is invested in what we call gap medication coverage, which helps people who are in between coverage or don't have coverage to get medications paid for. This includes the 30-day injectable shot Sublocade. And I'm not a shill for industry. The fact of the matter is that medication's making a major difference for people. It's one shot once a month. It helps remove withdrawal, so it helps a person to think clearly and feel themselves again. And it actually has the potential to block the effects of other opioids, preventing an overdose death. I personally, in my own practice, am seeing people, and my colleagues are seeing people, where they've really struggled with stability and really struggled to show up at a pharmacy every day and those sorts of things. And they're finding the freedom of that medication very, very helpful. And we're just really fortunate. I'm really grateful, Minister, that the decision was made to add that to the coverage here in the last year, because it's making a real difference.
Perfect, thank you.
Thanks so much, everyone.